Hello there, welcome to MHTV. Really pleased to have you with us. And today I think we've got a subject which is something that everybody needs to know about. And we'll be talking about quality improvement and how you can use it in practice. We've got a fantastic guest. But before we get started, let me throw it over to Dave so he can tell you how to join in and ask any questions that come up for you. Dave?
Yeah, thanks, Nicky. Hi, everyone. It's great to be here tonight. As always, a couple of ways you can join in with MHTV episodes. The first one is if you head over to our Facebook Live page, where you're obviously watching this. If you just head to the right of the screen, there should be the chat. You can put any questions or comments or thoughts in there, and we'll try and feed in as much as we can tonight. The other option you've got is if you're also on X, if you just use the hashtag MHTV, I'll be keeping an eye out for that hashtag tonight over on X. And again, any tweets that we can bring in, we will do. But without further ado, straight back to you, Nicky.
Yeah, and let's welcome our guest. Hello, Oz. We're really, really pleased to have you with us. I hope you don't mind. We're going to be picking your brain for all your experience tonight. Hello.
Hi.
Hi.
No, I don't
Tell us a
mind.
little bit about
Looking forward to
yourself.
the conversation.
Fantastic.
So my name is Oz. I'm a mental health nurse. I've worked in healthcare now for probably about 21, 22 years now. I started off working on inpatient wards, acute mental health inpatient wards. And I caught the bug at that point around improving. So I was involved in an old thing called Essence of Care, where on the wards we were really trying to create partnerships with our service users to partner together to improve services. And one thing that I learned in my nurse training that always stuck with me was what we called action research, which is actually feeling empowered to improve things as you're working there. So worked on the wards for some time, and then I left the wards to help set up an intervention in psychosis services, which was absolutely fantastic, working with young people during their first episodes of psychosis and actually developing the service together and what we offer them and how we work together in a slightly non-standard way, which was hugely impactful. Over the last 9 years, I've been working in quality improvement at East London Foundation Trust. We've had a quality improvement program for just over 10 years now. So from the very early stages of it to growing it and using improvement to solve complex problems. So yeah, that's kind of my history. Like everyone else, yeah, I also see myself not just as someone who helps to deliver services, but also someone who uses services. So I always think about, when I use GP services or when I go for eye appointments, dental services and my children. So that motivates me to contribute to improving services because healthcare is so unique. You're both a provider of the service, but also a recipient of the service in one way or the other.
Yeah, definitely. Thank you. So let's start off with the absolute basics. So can you sort of tell us, what is QI?
So QI, probably people hear the abbreviation used a lot. It stands for quality improvement. I suppose a simple way of putting it, it's a systematic approach of trying to tackle complex problems. It's built around focusing on outcomes. So really focusing on outcomes, but trying to flatten the hierarchy as you do that so that you can enable staff and service users and carers who are really at the front line of service delivery or receiving services. You're really trying to empower them to be able to redesign the services. And the one thing, because that just sounds like change management. I think the key thing that you'll notice with quality improvement is it's built around continuous testing and learning. And when you start the work, you might have a prediction of what's going to work, but actually these are complex problems that you're trying to apply the method to, which means we probably don't know what's going to work, which means we need to have the freedom to test and learn. We might not actually solve the problem, but we might learn what doesn't work. And we try and test at a small scale. And as we build a degree of belief around, what are the solutions that work around this, then we can start to scale that and make it business as usual.
Yeah, and it's interesting as well because you've got such a long history in working in QI. That's a real interest. So I remember old Essence of Care in the box back in the day. So can you tell us a little bit about maybe how in your experience, the whole idea of QI has changed over that time?
I think before we had QI as it is now, at least before we were exposed to it in my organization, I remember working in the early intervention team and working across community mental health services. And what was interesting was I was working in a borough in London, in Newham. So if in my team with a specific challenge, complex problem, I'll probably bring some people around it, would try and solve it, and we'll probably solve it. But that was it. It stayed within our team. If I moved on or someone else moved on, almost those wins would go with the people. So one of the key things that I've seen as a difference when you use QI is actually what you're trying to do is to capture the learning, but also have an easy way of sharing it. So if I think about the improvement work I've done throughout my career, a lot of it was built around, how do you manage change? Maybe not a specific method, maybe you might use a bit of project management around it. But what's great with quality improvement, particularly the way we're approaching it in the UK, we almost have a core set of principles that we all apply and a common language around quality improvement. Which means if I'm talking to someone who works elsewhere in England or even in Scotland, for example, where we learned a lot about quality improvement, when they talk about their theory of change, you know what that is. When they talk about testing, you know what that is. When they talk about measurement, you know what that is. So that means it gives us the opportunity to really scale things that work.
That's really encouraging, isn't it? Because I think one of the difficult things is when you're working what you know is a complex structure, it can feel almost impossible to make things different. And you're talking about different types of methods and almost like trying things and almost having like kind of not playful in a small sense, but actually creative approach to QI. Tell me a little bit about the methods that you use.
So the specific method we use, at least in my organization, and it's something that's used across the whole of Northeast London as well. So across our acute care services, our community health services, primary care, and we see this as an approach that's being used more and more across at least across England. And I know our colleagues in Scotland use the same method. It's the model for improvement. It's mainly associated with the Institute for Healthcare Improvement, which is a not-for-profit organization, typically called the IHI. I really like this method. There are different methods out there of quality improvement. There's some that are really complicated that you almost have to learn another language. You have to learn a bit of Japanese to do improvement. But what I like about the model for improvement and the methods that sit underneath it is it's really simple. I remember more than 10 years ago when I went for my first QI training. Actually, it was the launch event of quality improvement in East London. They gave us these ID badges that we wore, and they had printed on there the method. So it's got 3 questions and the engine for doing the work. 3 really simple questions. What are we trying to accomplish? So being clear about your aim, and smart aim, how good, by when, and where you're going to be doing the work. What changes can we make that will lead to improvement? So being very clear about, here are some of the things we're going to try. What's our theory of change? How will we know that a change is an improvement? So having some kind of measurable way of knowing whether you're going in the right direction. And then sitting underneath that is what's typically called the PDSA cycle, plan, do, study, act. So when you've got those 3 questions answered, then most of the work happens within the PDSA cycle. So got an idea, you make a plan, but here's what we're going to test, maybe usually small scale. Here's our prediction around it. Who's going to do it, where they're going to do it, how are they going to do it, when. Doing bits, actually running the test. And the typical thing we say in QI is, what can you test by next Tuesday? Because you want to get to action as quickly as possible. And as you're doing that, you're collecting some data. What are we noticing as we're doing this? And then the study bit is you bring it all together. What should we learn from this test? What prediction did we have? And what have we seen from running the test? Any unintended consequences that we've seen, positive or negative, from running that test? And then the act bit, what are we going to do next? Are we going to adopt the idea? Have we tested it enough? to adopt it and make it business as usual. Or maybe actually we've learned something here and we're going to tweak it. So maybe we're going to adapt it a little bit. Or maybe from testing, we've learned that actually this idea doesn't work at all. We're going to abandon it. So you're constantly running through that cycle of testing. So it's brilliant. I love it. You can literally have it on an ID badge, and everything else is built around that.
Yeah. And you've been saying like we. Who is we in this? Who are the people that are involved?
That's a really good question. So one of the key parts around quality improvement is you really need to bring people around the problem. So it's less about the most senior people, the most experienced people being involved. You're actually trying to involve people closest to the problem. So a typical QI project team will have staff who are close to the problem that they're trying to solve. You'll have your service users. You might even have carers on there. And if you have other system partners, so let's say from the voluntary sector, if they can contribute to solving the problem, they're involved as well. So you're trying to get a small group of people who represent the different parts where that problem exists or who can have an impact in solving it. You're trying to bring them together and empower them to generate ideas, test, learn, and then eventually scale up.
And how do you manage, obviously, because people are so busy and so stretched, do you find sometimes people are less enthusiastic to get involved, or how do you get the right kind of people to help you and share their ideas?
Again, another really good question. I think what's really challenging is anything extra that we do feels like extra work. So it's not unusual for me to speak to people who will say, I'd really like to get involved in improvement, but I can barely get the day job done in the time that I have. But sometimes it's actually just scratching below the surface a little bit and kind of saying, actually, if this problem persists, what will it mean for you or for the people you're trying to serve? Because sometimes if we do nothing, then we're going to spend a lot of time with workarounds around that problem. Whereas if we solve it, it's probably going to create capacity. So we always try and say to teams, if you're going to work on something using QI, work on something that really matters. So sometimes it actually starts with that question, what matters to you? So trying to identify the quality issues. So instead of maybe one senior person coming and saying, here's the priority for us to work on, actually it's going to that team of people who deliver and receive services and says, actually, what's the biggest problem you're facing?
I think you've really hit the nail on the head there. Because often what seems like the issue to someone looking from the top down is not at all the issue that's being experienced by people on the ground. And you almost stop seeing workarounds. Often we have this idea, well, the system runs like this, and then the reality is like this. And you end up trying to spend so much of your energy trying to make the two even touch each other, not overlap, but just vaguely touch each other. And you forget that actually that's not a great way of working. You get so used to it. You get so used to duplicating work or filling in two forms for one thing because two systems don't talk to each other. And you get to a stage where you forget, actually, if this was done right once, it would only have to be done once. So I think you're really onto something there. The other thing that was sort of in my mind was this idea that sometimes we can be a bit hierarchical in health. And I wondered, how do you figure out who you need to speak to?
So I think the approach we've taken, and I know a lot of people take this approach when they're using QI, is how can you give the people who are going to be working on this problem, how can you give them the permission in advance? So one of the ways we do this in improvement work is we ask a team that are going to be working on a problem to put down a charter. So a charter is a summary of, here's what we think the problem is. Here's who's going to be involved. Here's what we think we're going to do. Just a quick overview of that. And we really encourage organizations to have some level of sponsorship. So someone senior enough within the system who can give permission and who can champion the work, but also who can give that permission in advance so that teams can go away and test really innovative things. It's when you do that, when you empower people, that actually you'll probably do. Because the challenge is we try and solve problems in the way that we've always tried to solve them. Sometimes the ideas that we're coming up with have already been tried. But if you really want something that's innovative, you have to give that permission. So sometimes that's a really good way of doing that. And having that sponsor maybe touching base with the team every so often. They don't have to sit in all the meetings. And there are all sorts of strategies and techniques that we empower teams with that help to flatten the hierarchy. So you might have a project team working on, let's say, violence reduction on an inpatient ward. You'll have someone very senior, maybe a consultant psychiatrist within that team. You'll have some service users on there. You'll have maybe some carers, who've had the experience of a loved one being affected by violence. You might have a very junior member of staff. So within those project team meetings, we've got a few techniques and approaches that help to flatten the hierarchy, to give everyone an equal voice within that, so that people who have ideas have the opportunity to share those ideas.
It'd be really good for us to come on to looking at how we apply QI in practice. But I guess one thing just before we get going, sometimes it can feel like system has a lot of issues. How do you help people pick the one that they need to say, this is the one? This is where we focus. How do you help people make that choice?
Yeah, that's always a really tough one. I've lost count of the amount of times I've met with teams and they're like, we've got these 5, 6, 7 problems. Where do we start?
Yeah.
I think sometimes just going back to, what matters to you, but also where is the opportunity for us to have a big impact here? What can we start with? Because what you might find sometimes with teams is maybe this is their first time trying to solve a complex problem using QI together. So maybe that's not the time to focus on the most complex problem that they have. So maybe something a bit more bite-sized, so that they learn how to work together. They build their degree of belief that actually we can achieve something when we work together. And sometimes actually it's just bringing the voice of the customer. So sometimes it's actually just going to their service users and say, what matters to you the most? And then working on that together.
Feels like a high stakes approach.
Yeah. And sometimes it's getting a sense of where is their will to solve. So you might have these 5 different problems, but actually among those, where is there the most will? Where are there the most ideas? And where is there the ability, the execution theory around that? So will, ideas, execution might be a way of deciding what to focus on.
Absolutely. That can be really helpful, I think. I can see, Dave, you've got a question before we get stuck into some other stuff. Tell us, what's your question?
Yeah, I think one of the things that I've been thinking about as we've been talking is obviously that bit about quality improvement being such an important thing to do, and the way that it will hopefully lead to more efficient services, more cost-effective services, deliver better services for patients. But the tension between that and healthcare systems that can be under extreme pressure. And I suppose, have you got any advice or thoughts on how, people that do want to develop kind of QI processes to resist the push and the temptation to have to just cut everything?
Yeah, that's a really tough one. What we've learned over the years is sometimes actually throwing it back to teams to say, what are you doing now that has little or no value, that if you stopped it, it will give you the capacity to work on something that matters more and has more value. Interestingly, when we did this at East London, we had what was called a Breaking the Rules campaign, which was actually going out to the whole organization and saying, what work are you doing that has little value? This was at the start of our QI journey. And there were so many things that came up, so many things that people assumed they were supposed to be doing, audits that they thought they should be doing. But actually, when it was fed up, it was actually, you don't need to be doing that. And I mean, before I went into QI, I was heavy into audit. But what I knew about audit was sometimes you do the audit, you collect the data, you make an action plan. You come back in 6 months' time or a year later, you do the same audit, you get the same results because there's no mechanism for doing something different. So sometimes actually stopping the audit and focusing on actually doing the work.
I can see how you found your way into QI. I honestly have met very few nurses who went, I was really into audit. It's a beautiful quality and one that will make you in much demand, I think. A couple of things have come through. One person has said, this all seems a bit of a very politically charged. And I think that's quite an interesting point, because I mean, some of the things that you're saying, you know, what are we doing that adds little value? I mean, where angels fear to tread on that one. So how do you manage this idea that this is, I mean, it's a third year student talking about, I'm praising their tweet, but saying it's about how do you decide what to tackle? How do you manage conflict and things that are sensitive to people? And if someone's set up a system and a way of working, and then you're like, actually, that there are improvements that can be made to that, that can be quite challenging, quite painful for people. How do you manage that, the people side of it?
Yes, that's a really good question. I think the huge challenge around this is you probably need to be in a place where there's the psychological safety to have those conversations to start with.
Yeah.
So a lot of this starts with leaders. So a lot of the work that we do around quality improvement in healthcare nowadays came from the work of W. Edwards Deming. And, you know, he did some work in the 1950s and 60s in Japan in manufacturing and things like that. But one thing I always remember, you know, he lays out specific principles for leaders, and leaders at every level. So, you know, positional or people who have a leadership role, they probably have a lot to do around this to create the kind of environment where you can question those. So when we had the Breaking the Rules campaign, for example, you know, our chief executive and what was our chief operating officer, you know, they were right at the heart of it. Most leaders across the organization were the ones who were saying, you know, we really want to hear. We really want to hear what things are getting in the way. We really want to hear about the pebbles in your shoes. We really want to hear about what are these rules that need to be broken. So, you know, some things have to happen at different levels in the organization to create the psychological safety to say, you know, let's be really honest. But here's what we know. Very famous quote is, every system is perfectly designed to get the results it gets. And that, again, is from W. Edwards Deming. So if the system we've got right now is producing these suboptimal or unintended outcomes, then ultimately it's designed to produce that. If we want a different outcome, we're going to have to do something differently.
Absolutely.
Yeah.
Absolutely. I can think of tons of examples of that, the unintended outcome. Yeah. So before we go into some of these more questions, can we just talk a little bit about how you've applied QI in practice? Because I think that will address a lot of the issues, the questions that are coming up. So I think you were specifically been working on violence reduction.
Yeah, I mean, we've applied QI to almost everything. And the way, you know, the way we do QI is you want a bottom-up approach where people closest to the issue can say, you know, here's the issue that we're facing. You empower them with training, a bit of space and time, and a method and a clear approach to doing the work, so that, you know, they can focus on the things that matter to them. So at any given point in East London, for example, we've got hundreds of projects. Those are all starting from the bottom up with teams working on them. So in the very early days of QI, when we were trying to explore this, you know, that was the invitation. People came on training and they were given the permission saying, now that you've learned the method, apply it to what matters to you. What was really interesting was when we then after a couple of years, themed the areas where people were applying QI to, those were the things that were important to the board, the things that, you know, we were continually paying attention to: right patient, right care, right time. So a lot of it has to do with actually trusting your people that they're going to work on the things that matter. So one of the earlier pieces of work was around violence reduction. So on one ward, mental health inpatient ward, they decided, this was in Tower Hamlets, they decided to work on violence reduction. I mean, this is really close to my heart because I remember when I was a charge nurse, when those still existed quite a while back. I had a student nurse who was on her first placement on my ward. And unfortunately, she got slapped in the face by a service user who was unwell.
Mm.
And I remember the conversations that happened afterwards. We were all almost normalizing it to say, this
Yeah.
is just part of being a mental health nurse.
Mm.
It felt like just part of the job to experience violence.
Mm.
So when this team decided to focus on violence, it was interesting. But actually, they were able to come up with multiple ways of a package of 4 different ideas that looked like they were starting to reduce violence. They then started to apply that on other wards at the same hospital in Tower Hamlets. Eventually, it's a piece of work that happened across the whole of the organization. So our services in London and in Bedfordshire. And across the board, on some of the wards, we saw reductions of between 40 and 57% reduction in violence.
Mm.
Multiple days without go without a single violent incident, which was unheard of. I didn't think it was possible.
Mm. Mm.
But right at the heart of it was, things around staff and service users together taking ownership of the environment that they are working in and that they're receiving services, creating communication around that, using tools that help them to predict violence. So when you look at the change package that they came up with, it's only 4 things. It seems really simple, but they had to test and learn their way through that. And it's a piece of work that's now been scaled through the Royal College of Psychiatrists, through the work of Dr. Amar Shah, who's now the National Clinical Director for Improvement at NHS England. So that piece of work has now been scaled up across most of England. So it really demonstrates that when teams apply the method, sometimes you actually solve a problem and you can actually scale the solution.
I think that scale is so important as well, because sometimes when you're working in your own little environment, you don't realize actually next door's experience is totally different.
Yeah.
And it's not just that they've got different staff or different clients, if they're doing something slightly different to you and they're getting a different outcome. And when you look at sort of violent incidents across trust or across all trusts, you see the massive differences, like in terms of the amount of incidents and things like that. And it's really stark, the differences. And you think, well, if everybody did what the people with the lowest are doing, maybe just get down a bit. Yeah. So you're saying you've used it for violence reduction. What other aspects of improvement have you used it for?
So I think one which is really a hot topic right now, we know in healthcare, one of the biggest challenges we're facing is access to services, so flow through the system. And I remember going back about 8-9 years ago, that was the first piece of work that I worked on. So in addition to teams applying QI from the bottom up, one of the things we tend to do is if we hear signals from our staff and service users that actually there's this common theme, a common problem across multiple services, we create a learning system that brings together multiple teams working on that problem so that they can accelerate their learning, they learn from each other. So one of the first ones that I was involved in was what we called improving access to services. So trying to reduce non-attendance, what we call DNA, did not attend, and trying to reduce wait times from when people are referred to when they receive a service. And we learned a lot from that. Teams were able to, reduce wait times, reduce DNAs, which was amazing. But what we soon learned was actually that sometimes shifted the problem to elsewhere. So with time, what we've learned is actually the issue is flow. You have to work upstream and downstream. So over the last couple of years, and even now, we're applying QI to flow, particularly inpatient services, where it really touches your heart, where you've got someone who's unwell, they come to a hospital, and maybe the hospital is full, so they have to be placed out of area. Or the little funding that we have in healthcare, you end up spending some of it on private beds, and maybe their family is no longer close to them, the support network is no longer close to them. So the motivation for teams to work on this is to try and solve some of those issues. So flow is one of those, and teams have seen a lot of really significant improvement around that. And what that does as well, it allows us to then work with our partners in the system. So, if that maybe one of the reasons that why occupancy is really high on our wards is people are medically free to be discharged, It's just that maybe they're waiting for a social care package or maybe housing. Then we're going to have to bring those partners along to say, let's work on this together. So we don't just solve the problem for one person,
Mm,
but we improve the system throughout.
mm,
So, that's been another really empowering one. And we've also used it for things like staff experience. We called it enjoying work. Um, there's a famous quote from Maureen Bissagnon from the Institute for Healthcare Improvement, which
mm.
is, you can't give what you don't have.
Yeah.
So if our staff don't feel that they're well cared for, or maybe they're overwhelmed, it's
Yeah.
very difficult for them to provide care, because this is a care industry. So one of the ways we've applied QI is actually empowering teams to apply QI to improving their experience of care. And what's been really heartening is we've seen service users being involved in those projects to say, actually, yes, I would like to see the staff have a better experience, because I know that will translate into better care for me.
Mm.
And so again, we've
Yeah.
seen significant improvement around things like that.
I think having those conversations are so important, isn't it? Because you realise staff and service users have exactly the same need for this to be a safe, happy, healing experience. Like it's in nobody's interest for it to be dysfunctional or aggressive or understaffed or upsetting. Like nobody is served by that. Yeah. It brings everybody into one team, and that's really important. I suppose the other thing as well is when you were talking about having the importance of having those conversations is to say actually what's useful and what's not, because sometimes we can think the activity we're doing isn't useful. We just don't know how it fits in. So you can assume something actually doesn't have a purpose until you have a conversation like, oh, so that's what it does. I never knew. I was just doing it. I didn't realize that information went somewhere.
Yeah.
Yeah.
And since the pandemic, one of the areas that we're really testing and learning around this is around equity. We learned a lot during the pandemic about inequality of outcomes and all sorts of things. And what's been really amazing is teams naturally turned to using QI to tackle equity issues. All we did was create a learning system around it, but multiple teams were already using QI to tackle equity. We've had some teams where on their wards, staff and patients were saying, actually, I've been experiencing racism and it's been normalized.
Yep.
But QI allows them that opportunity to flatten that hierarchy, to come together and say, here's the experience I'm having. Are you having the same? And what can we do about it? And then generating ideas and working together around that. So I think that's really empowering to be able to use a method around something as complex as equity.
It's so important, isn't it? I mean, to recognize racism as violence and as almost like a toxic spillage that harms everybody. And you'd act to remove anything like that from your workplace.
Yeah. And things like, maybe noticing that some communities are not accessing services, for example. And the typical approach of, they're hard to reach. No, they're not hard to reach. We need to rephrase that and think about how do we make our services more accessible? How do we bring them around the table so we can work through this together? So I think it's really empowering.
I'd love to see the end of hard to reach, because it's such a garbage term. But I suppose it tells you where your problem is, doesn't it? With the service being inappropriate for them. Yeah. I've got a couple of questions. Are you ready for some student questions coming at you?
Yeah.
How do you stay motivated when things are so difficult sometimes?
That's a really good question.
I know they do ask hard questions.
I don't know if I've got the right answer for that question, but I can give what I.
Any old answer would be fine. Go for it.
Yeah. I think actually having the opportunity to try and solve something is probably really powerful. I remember the quote from Edison once he created the light bulb, and he was asked, what did it feel like to fail, 999 times or 1,000 times? I'm probably butchering the quote. But he said, I learned 999 ways of how not to make a light bulb. So that's what I love about QI. It's different to other approaches of trying to solve problems, because the outcome is not predetermined. but what's definitely in there is learning. You're going to learn. I've met with teams where they've tried to tackle a quality issue using QI. And they had their aim, we want to achieve this by this date. They got to that date, extended it, never achieved it. They closed down the project. But actually, when you hear their reflections, they actually learned a lot about the system that they're working in, what's not working, maybe what got in the way of the success. And maybe the next time they try and tackle it, or someone else tries to tackle the same problem, they can literally pick up from where they left off. So I think what keeps me motivated is the opportunity to keep testing and learning. It's an opportunity to learn. These are really complex problems that we've been trying to solve for a really long time. And I think as long as we're trying to solve them, at least we're doing something, instead of just accepting that, these are problems and they're going to continue to exist. So that keeps me motivated.
Okay. How do I get involved in QI as a student?
That's a really good question. So interestingly, when we started on our journey in East London, we open up QI training to all of our staff. But what we also noticed was actually we've got a lot of students who come to the organization. So we started to do some work upstream. So working with some universities, doing some intro to QI training there. For example, City University in London. Eventually, a lot of universities have included a QI module in their training. So what I'll say to a student is, if you go on placement somewhere, ask that question. Is there QI training? If there is, in most cases, it's open to everyone. But I know that places like NHS England, or even the IHI, Institute for Healthcare Improvement, there are different places where they have bite-sized QI training online that you can access. So I suppose just start to ask those questions from wherever you are. Is there QI training? Can I get involved? Can I learn the methods and how to use them?
Yeah. Are there any particular resources that you think will be useful for people in practice at any level to have a look at? Anything you'd recommend?
So, I mean, I'd recommend the two resources I use myself. So I use ihi.org. So that's Institute for Healthcare Improvement, ihi.org. And I think one of the key things that we did at East London Foundation Trust, I've worked there for 21 years. A lot of stuff set on an intranet, behind some kind of firewall that prevents outside people from seeing it. But when we started our journey on quality improvement, we made everything that we're learning publicly available. So even if I'm sitting down and I'm coaching a team and I need to remember a tool, I go on elft.nhs.uk, our website, because the QI tools, the methods, the examples, the videos, the stories, everything is publicly available. You can access it on your phone, tablet, browser, all for free. So I think that's my encouragement. Look for free resources out there, but those are two really good ones. I had a colleague who joined our organization 4 years ago. Her name is Catherine Britton. She was working in South Africa, so she's originally from Scotland. She'd been working in South Africa, living in South Africa for many years. And so when she came to join us and she started working for us, she's like, when I was in South Africa, I used to use the ELF website for QI. So it's a free resource that's out there. Use it. Yeah.
I've got a couple of absolute doozies for you. You ready?
Right.
My favorite one that I've seen so far is, what do you do if the change makes it worse?
Well, you've learned something, and that happens. There's something that we use when we're working on quality improvement. It's called the lens of profound knowledge, or system of profound knowledge, by W. Edwards Deming. And one of the 4 quadrants around it is what's called appreciation of the system. I think you have to recognize that sometimes that is what the system is churning out. Probably it actually helps you to understand, maybe we've been focusing on the wrong area here. We probably need to pivot and focus on something else. But inherent in quality improvement is the opportunity and the permission to fail. Particularly if you do it in a very structured way, small scale testing, so that, one example I give is I was working with a community health service, and I think it was like a physio service in the community. One of the complaints they were getting was when people were trying to contact them, they'll ring, the phone wouldn't get picked up, and it would hang up. So a lot of people who were referred weren't accessing the service because they couldn't get through. So they came up with an idea. Why don't we use one of those phone systems that is some kind of answering service or queuing system? What they wanted to do was, once they had the idea, they wanted to go and procure that piece of software, thousands of pounds. But we said to them, why don't you run a small scale test? Approach the provider of that system and say, can we have a free trial for a week, for a month, so we can test more? We don't invest a lot of money and time into it, and you learn. So a lot of things you're going to test aren't going to work.
Yeah.
But if you keep at it and you have that resilience, and you have people around you who are sponsoring the work, giving permission, you've got people who represent different parts of the system, you'll probably learn a lot, and hopefully you'll probably improve the system as well.
Okay, this is the last one we have time for, so sorry for people who've asked something else, but this is the one that potentially could land you in the most trouble. Left it till last. What was your favourite project to work on, and why? I like the idea that you have a favourite, because that implies the others aren't your favourite.
You know what? I'll tell you what my favourite one was. It was the enjoying work piece of work. So we did like 4 waves of this, 4 years continuously. Probably more than 50 teams. Probably almost a third of the organization was touched by this work.
Yeah.
And what was my favorite is, you'd think that is focused on staff, but what really came through was the service users and carers. They really showed up for staff. Some of them were running relaxation sessions for staff. When we had our staff awards, they had a special song specifically for our staff. And it really helped me to see that actually at the end of the day, I might wear a badge that says, Associate Director of QI or nurse or whatever it is. I'm still a service user. And we can all contribute to making the services wherever we live better. So I always say this to people that, whatever role you have, when you put away your uniform or your badge, wherever you are, their service is there. And if you've got some skills, maybe reach out and say, I use your services, my children use your service, how can I contribute? So that's what I learned from that one. And because it's enjoying work, with a huge smiley face around it, it was all joy. So I think those were my favorite ones.
Yeah, good answer. I think as well, I'm looking to see the time has got away from us as ever. So we're gonna close out now. Perhaps I could come to you, Dave, if there's any thought that you want to ask or anything you want to finish up with, and then we'll come back to Oz for any last thoughts that he has on QI.
Just a few final thoughts from me, Nicky. I think it's been really nice to start listening to the conversation tonight. I've been quite busy doing lots of X posts from the references that Oz has shared before the episode. So hopefully that'll be a nice little extra resource above the couple of websites that he's encouraged people to head towards. But I think one of the really nice things is that, there's lots to get downhearted with when you work in health, isn't there? There's lots to be frustrated by, lots to feel, the day in, day out slog, but it's really nice to kind of focus on a subject that does feel, relatively positive and can make a difference to people's lives. So I'm really glad we've had this subject tonight, and I think in a probably a general election year, it's nice to kind of have that really positive focus and spin on health. So it's been great to listen along to that, and I think one of my reflections as well on the conversation is, it's important to have staff that can be involved in QI, but I imagine it's really important to have managers that provide that space. And like you were saying before about Break the Rules Day, I think the problem becomes when staff then do break the rules and they get punished for it. So it's really important that managers, really mean what they say in those kind of environments. So it's been great to listen along to tonight.
Yeah, I've really enjoyed it. Oz, was there anything that you wanted to leave people thinking about?
I think my invitation is try and find a way, because I know, particularly for the students, as you go to different places, maybe on placements, you'll see what doesn't work. And you've got a fresh pair of eyes. So think about how you can get involved in improvement. Instead of just complaining and leaving it there, offer to help. Do the same in the services you receive. Maybe you're trying to phone up your GP service and you never get through, and maybe there's something, you've got a suggestion. Find a way of contributing to solving the problem. I think that's when you can have the biggest impact.
Absolutely. Maybe your next QI project would be GP access. Let's all stop ringing at 8:30, hoping it works. But I love that, and thank you so much for sharing your experience. I know that you're busy at a conference today, so really appreciate that. Next week we're looking at Women's Peaky Time for Change, so it really feeds in really well to what you've been talking about. And thanks to Vanessa, who's tweeting at home, and Dave as well for sharing all those resources. Really interesting and important work. So thank you very much, everybody. Thanks for your time tonight, particularly to Oz, our fantastic guest. And good night, all. Good night.
Night. See you next time.